China's National Health Commission has stopped publishing daily COVID-19 data amid concerns about the reliability of the figures after infections exploded in the wake of an abrupt easing of tough restrictions. The country has although not specified the reasons for the same. The government's action comes at a time after a leaked document suggested that about 250 million people in China may have been affected by COVID-19 in just 20 days after the zero-COVID policy was diluted in the first week of the month. Relevant COVID information will be published by the Chinese Center for Disease Control and Prevention for Reference and Research, said the Health Commission in a statement. Notably, neither did NHC specify any reason for the same, nor did it inform when and how frequently the COVID information will be updated. For the past 3 years, the health body has published the daily COVID figures of the country. The sudden halt to the reporting of daily infection and death totals comes as concerns grow around the lack of vital information made available since Beijing made sweeping changes to its zero-COVID policy that put hundreds of millions of its citizens under lockdown and battered the world's second-largest economy. Despite the record surge of infections, the NHC has reported no COVID deaths nationwide for 4 consecutive days before halting the data release. Last week, China narrowed its definition of a COVID death, counting only those from COVID-caused pneumonia or respiratory failure. According to Radio Free Asia, leaked government documents are making rounds on social media which hints that around 250 million people may have been affected due to the infection in just 20 days in the first week of the month after the stringent zero-COVID policy measures were lifted after massive protests. The leaked document suggests that 248 million people were infected with COVID-19 from December 1st to 20th, or 17.65% of China's population. A senior journalist told Radio Free Asia that the document was genuine and had been leaked by someone who attended the meeting who was acting deliberately and in the public interest. Hospital morgues in China are fully packed as COVID cases are sweeping across the country, with experts forecasting million to 2 million COVID deaths next year. The current COVID surge is driven by the highly infectious BF.7 variant, which poses a risk to the nation. Last week, the World Health Organization (WHO) warned that China may be struggling to keep a tally of COVID-19 infections. The WHO has received no data from China on new COVID hospitalizations since Beijing eased its restrictions. The lack of data transparency has made monitoring the scale of this most recent COVID outbreak difficult. The country's healthcare system has been under enormous strain, with staff being asked to work while sick and retired medical workers in rural communities being rehired to help grassroots efforts, according to state media.